Hello, I am Junseok Bae at Wooridul Spine Hospital. Today I am going to review of thoracic spine surgery thesis generally. In many university hospitals, thoracic spine surgery is major surgery, high frequency of complications. The operation is very dangerous and difficult. You may have heard of it. Many patients and suffer a lot from thoracic ligament ossification, thoracic disc herniation, yellow ligament ossification. Because of high risk of thoracic surgery, patients are worried about paralysis of the lower body after surgery. That's why people are reluctant to have surgery. In fact, there are many different types of surgery. There is no established evidence that one surgical method is necessarily superior to another. The thoracic vertebrae are anteriorly covered by the lungs and heart. In addition, since the spinal canal is very narrow on the back side, the safety margin for safe entry through surgery are very narrow. So thoracic disc has to be treated but hurt less. Backside approach or different angle to the side. Approach a little further from the side, or enter completely from the side or totally anterior approach. In this way, 360 degrees centering on the thoracic spine, and many approaches have been developed. Surgery on the back. The risk of nerve damage increases because the nerve is tilted a lot when surgery is performed on the side of the back. A lot of bones are removed. Future screwing. As a result, secondary complications increased. In the case of an anterior approaching, the high risk and the difficulty of the operation. So it is relatively safe to unnerve, but due to the lack of experience, doctors are reluctant to do this surgery. The reason for performing endoscopic surgery is obvious. The cause of this procedure is to remove the disc that is compressing the thoracic nerve, but other structures related to disc. In other words, we treat only the disease without touching the disc bones, nerves, or muscles at all. The method developed in this way is the thoracic endoscopic disc procedure. Thoracic vertebrae, the bones are very thick, but narrow. For this reason, compared to the neck or lumbar, the access route is limited. So a very special shaped endoscope is required. So we had this idea years ago. We started developing a surgery, and this was completed about 4 years ago, so we are very active in surgery now. In the past, thoracic endoscopic surgery requires a lot of preparation. Also, it was possible in very limited cases. Currently, most disc patients are treated with thoracic endoscopy.